The U.S. has passed more than 1 million COVID-related deaths, says the White House. President Joe Biden said the country was marking a tragic milestone.
1 million COVID deaths. 1 million empty chairs around the family dinner table. Each irreplaceable losses. Each leaving behind a family, a community, forever changed because of this pandemic.
It's the highest official death toll in the world, although the World Health Organization believes the true death toll may be much higher elsewhere. The U.S. has also recorded more than 80 million COVID cases out of a 330 million population. The first confirmed case was reported on the 20th of January, 2020, when a man flew home to Seattle from Wuhan in China. The 35-year-old survived after 10 days of pneumonia, coughs, fever, nausea, and vomiting, but deaths began to be reported just a few weeks later. In the 2 years since, death rates have ebbed and flowed as waves of the virus swept across the country, reaching highs of more than 4,000 a day in early 2021. Public health experts give several reasons for the high U.S. death toll, including high rates of obesity and hypertension, overworked hospital systems, some vaccine hesitancy, and a large older population. The president ordered the White House flags to be lowered to half-mast to mark the milestone. The dangerous surges where our hospitals were full and new deaths were overwhelming have all come on the heels of new variants. Dr. Mark Cameron, an associate professor in the Department of Population and Quantitative Health Sciences at Case Western University in Ohio, told the BBC.
So that we are ready for the next one that would come along, and there will be a next one. And we are watching for that around the world and planning for the inevitable and being ready with new vaccines, new platforms, new research, new therapies for when the next one comes around.
Most of the 1 million Americans who died during the pandemic lost their lives after the vaccines were introduced. That's down to the sheer scale of people still catching the virus. It does not mean the vaccines aren't working. Vaccines massively cut severe COVID risk. A study from the RAND Corporation credited the jabs with saving 140,000 lives in the U.S. by May 2021 alone. A separate analysis by the Peterson Center for Healthcare and the Kaiser Family Foundation in April this year estimated that around a quarter of the U.S. deaths, about 234,000 people, could have been prevented with vaccines. Everyone knows someone who had the whole vaccination regimen and still got very sick, Dr. Cameron added. But the data is clear. The risk of COVID-19 and death is higher in the unvaccinated.
We've heard stories around the world of people being infected with COVID-19 twice, and that's because their immune response was not what we expected.
Of the 50 U.S. states, the highest death toll has been reported in California, where about 90,000 people have died. California is followed closely by Texas, about 86,000, Florida, about 74,000, and New York, about 68,000. Dr. Monica Gandhi, an infectious disease physician and professor at the University of California, San Francisco, said vaccine hesitancy also explains higher death tolls in certain states. In her analysis, shortcomings in vaccinations have contributed more to the U.S. death toll than other public health measures, such as masking or isolation. While deaths have been reported across all age and ethnic groups, experts note that certain sectors of the population have been more likely to die, particularly the elderly and those with comorbidities. Government data shows the vast majority of COVID deaths in the U.S., about 740,000, have been among those older than 65. Looking at severe illness and death, the demographics haven't changed throughout the pandemic. CDC data analyzed by the Kaiser Family Foundation shows that overall, particularly in the early stages of the pandemic in 2020, Black, Hispanic, and Native American populations experienced higher rates of both infection and death. Public health experts cite a range of reasons, including vaccine hesitancy among some groups and an elevated risk of exposure due to working and living conditions. While the death toll from COVID-19 now officially exceeds 1 million, the indirect toll of the virus is likely to be far higher as a result of the disrupted health systems and a hesitancy to seek medical attention for the fear of catching the virus. One study, published in the journal PLOS Medicine in May 2021, found that for every 100 deaths directly assigned to COVID, another 20 excess deaths occurred that were not, many of them in areas with lower socioeconomic status. A study released on Thursday by the World Health Organization put that figure at 140 excess deaths per 100,000 people during 2020 and 2021, totaling about 930,000 more lives lost than what would have been expected on average. It will be years before we even come close to understanding the impact COVID 19 had on our overall morbidity and mortality rates.